When most people think of IVF, they think of it as a conventional IVF, but there is more to it. Recent advances in IVF has helped many women with recurrent abortions, recurrent implantation failure, and also with thin endometrium patients. Hi, I am Dr. Radhika, Consultant Fertility Specialist at BirthRight Rainbow Hospitals, LB Nagar. Let's explore some of the recent advances in IVF. There is 3D ultrasound to identify the uterine anomalies like the septate uterus, subseptate uterus, and also the bicornuate uterus, unicornuate uterus. Then we also have fibroid mapping and polyp and the adenomyoma mapping. Then we have hysteroscopic installation of the PRP and stem cells in cases of the thin endometrium and also Asherman syndrome. We also have ERA, which is endometrial receptivity array, which identifies the window of implantation. So we get a report of whether it is receptive, pre-receptive or post-receptive, and accordingly we do the embryo transfer. We also have better test for identification of the infection of the uterus, which is the chronic endometritis panel. Then in patients with recurrent implantation failure and recurrent pregnancy losses, we do LIT, which is a lymphocyte immunotherapy. Patients have benefited a lot with lymphocyte immunotherapy. Now coming to the ovarian advances, we have the 3D ultrasound, which is called as the Sonovac, for identification of the number of the follicles and the size of the follicles. Then we have laparoscopic installation of the PRP, the growth factors, and also the stem cells, which is called as the Ovacira. And this is beneficial especially in patients where the previous cycles did not give any embryos or there were less number of the mature oocytes. Next, we also have cryopreservation of the eggs, which we do in patients who want to preserve their fertility potential. Next, coming to the stimulation protocols, we are also doing dual stimulation or the random stimulation protocols, where we are giving injections not at the day 2, but we can start at any time of the cycles. The injections what we give are also the needle-free, painless injections. We use the pen instead of the syringes. So these are the changes, some advances in the ovaries and the stimulation protocols. Now coming to the embryos, we are already transferring day 5 embryos, the frozen embryo transfer instead of the fresh embryo transfer. And recently we are moving towards more single embryo transfer than double embryo transfer to avoid preterm in cases of the multiple pregnancy. Then we also have time-lapse monitoring of the embryos and artificial selection of the embryos, genetic testing of the embryos through PGT-A, M and PGT-SR, non-invasive chromosomal testing of the embryos. Next, coming to the lab advances. In the labs, we have the closed working chambers, RI witness monitoring system, 24 hours temperature monitoring, better techniques for vitrification and thawing of the embryos, and also better lab conditions. Next, coming to the genetic testing. In patients with consanguineous marriage and previous multiple abortions and previous baby with abnormal disorders, we have the gene testing through whole exome gene sequencing and also the carrier screening. Now coming to the male factor, previously azoospermia patients, donor sperm was the only option, but now in such patients, we have TISA and micro-TISA techniques. Then we have IMSI and LIMSI also, and better sperm sorting devices, which is called as the MAX. There is also identification of the DNA by the DFI testing, that is the DNA fragmentation index, and also testicular rejuvenation like the ovarian rejuvenation, and the sperm freezing or the testicular freezing like the ovarian freezing. So these are some of the recent advances in the IVF. Thank you.